Good morning, everybody. As Jeff said, my name is Mike Hann, and it's been my pleasure to be at Brooklane for the last 2 years or so. I'm getting from you. I'll grab that from you. For the last 2 years or so, and in the last 2 years, I've been able to get to know the community, many of the community partners we have here in the room, and it's a very special place to work. So when we had the opportunity to come today and to talk about the ABCs of caregiving, it was an opportunity that I really looked forward to. So looking forward to the chance to talk through some basic principles from a medical perspective, but also from kind of a psychosocial perspective with regard to being a caregiver, what that takes, what supports are there, and how one can walk that journey in the best way and with the partners that so many folks in this room here have identified. So just to start, I have no disclosures, of course. As the speaker, you always want to say that. I wish I had some financial disclosures, but I don't. So no disclosures here. This is all just my experience and kind of my 2 cents on the topic. But I think as a starting point, it's important that we actually put some definitions out there and kind of define what we are talking about with regards to being a caregiver. So in the United States, like most other developed countries and developed economies in the world, the populations are becoming older, right? So our average age in the United States, throughout the European Union and most developed economies is increasing on average. Our workforce is living longer, which is a good thing, and that's testament to some of the developments in medical science and that sort of thing. But with an increasingly older population comes other challenges that we have to manage. Things like chronic illness, things like medical comorbidities that we haven't had to manage as much in the past. So the dynamic of a caregiver is one that we need to understand as a society, and that we need to increasingly become more attuned to. So just definitionally, we're going to refer to caregiving as the act of providing physical, emotional, and logistical support to a person in need, who typically might be struggling with either a chronic illness, an injury that might require prolonged rehabilitation, or just any folks that need some of that comprehensive care. And it's important to emphasize that the caregiving relationship is really multifaceted. So it's not simply providing the medical care. It's not simply providing the logistical support that one might need in order to get to their doctor's appointments. It's a multifaceted relationship that really spans through the entire aspect of the lifespan. So medical management, physical care, emotional support. As a psychiatrist, we want to kind of stop there, because the aspect of emotional support is really a bi-directional support there, because it's not only the support that the caregiver is providing to the individual in need of care, but the self-care that the caregiver must prioritize in order to make sure that they can take care of themselves throughout that relationship as is necessary. So that's kind of, when we talk about the caregiving relationship, biggest takeaway is that this is a multifaceted, multidimensional relationship, and it can be very challenging. So it can be very challenging to do, and we've got some recommendations as to how we can lighten that burden, which we'll get into. All right. So there's caregiving, and then there's what in the literature we like to refer to as informed caregiving. So in order for one to provide the best care possible to somebody in need, but also to preserve their own sense of emotional, mental, physical, and spiritual strength through that relationship, it's important that they're informed. And the best way to be informed is to educate yourself in as many individual aspects of the person's care as possible, but also more generally in terms of what it takes to be a caregiver and what resources are out there in order to support the caregiver. So if we look at studies, we know that we actually see better health outcomes when the caregiver is engaged in gaining education, being proactive, with either in the medical aspects, but also in the psychosocial aspects of an individual's care. We actually see better health outcomes with that. We know that caregivers who are informed and staying involved, actively involved in the care of a patient tend to do better themselves with regard to stress management and their own psychological health. And we know that there's a richer and more engaged dynamic interaction with healthcare providers and with the healthcare system when you have an active caregiver that's engaged in the care of the patient. So we want to go from being a caregiver to being an informed caregiver, which means being as an active participant in the care of the patient as possible. So let's start with the medical aspect of things. So one of the things that we wanted to address with this discussion was just some pointers in terms of common things that we might encounter from the medical side when we're caring for folks with chronic illness or folks who might be struggling in some way there. So in particular in older populations and folks with chronic illness, it's very common that you'll have medications that are being taken on a daily basis, often multiple medications, and those medications can have different types of interactions with each other. So we refer to that in the field as polypharmacy. So polypharmacy is when you have multiple comorbidities, you have multiple illnesses for which you might be needing to take multiple medications for. And there's common ones that you'll likely see and encounter, and some more often than others, but we've got a list up here. These common medications, while often benign, when we take with other medications, can lead to certain interactions that can cause certain side effects and that sort of thing. So we wanted to take a few minutes in this discussion and talk about what some of these common medication classes are that more often than not somebody who is in need of a caregiver might be taking, and then what might be some possible side effects to those medications. So pain relievers, very common. Those are things you probably think about routinely, some over-the-counter, NSAIDs, Tylenol, acetaminophen, Aleve, naproxen, those sorts of things, very common. Over-the-counter and very benign, but work more often than not through with your kidneys in order to process and metabolize those agents. So if somebody is on dialysis, for example, or has a chronic condition related to kidney function, pain relievers might be something to be aware of when we're taking those medications. Blood pressure medications, very common. Cardiovascular illness is still within the top 3 leading causes of comorbidity in the United States, so something definitely to be aware of. Those are things like beta blockers, lisinopril, ACE inhibitors, those sorts of things. Diabetes medication, there's a wide variety of those, from metformin to insulin to various other types of anti-hypoglycemic agents, so something to be aware of. Cholesterol as well, things like statins, very common, very beneficial for long-term health. Actually, statins are one of the primary contributors to the longer lifespans that we enjoy today, because they have been so successful in managing the cholesterol issues that have resulted in cardiovascular illnesses like myocardial infarctions, but also can potentially come with some side effects. And then, of course, medications for mental health, so things like antidepressants, antipsychotics, medications that can be used to treat mood, anxiety, those sorts of things. Very important, but also can come with side effects as well. So more often than not, when somebody has these chronic illnesses, we're dealing with more than one thing at a time. So it's important to really try and have an understanding of what the patients are taking, what they are taking those medications for, and how we can best support the patient as they're managing their illness and taking these medications. So what should we be looking for? Well, there can be some common side effects to medications that are important to pay attention to when patients with chronic illnesses or in need of care can suffer from. So you always want to be on the lookout for physical signs. Physical signs are often what we call sensitive, but not always specific, meaning the physical signs that somebody might be experiencing a side effect from a medication or a symptom of their illness might be fairly non-specific, but usually that should be the cue to put on the detective hat to kind of inquire as to whether or not something might be going on. We might need to talk to the healthcare providers on that one. So things like gastrointestinal issues, anything related to that, nausea, vomiting, constipation, diarrhea, etc., definitely should trigger consultation with a healthcare provider. Dizziness and fatigue, that can come from lots of different factors. It can come directly as a side effect to a medication, but it can also be related to issues with cardiovascular functioning, respiratory functioning, etc. Blood sugar fluctuations, so anytime we're dealing with diabetes being a very common condition within the United States and around the world, anytime you have those fluctuations in blood sugar, you can see everything from lightheadedness, dizziness, to, in the most extreme, things like seizures and whatnot. So definitely something to be very aware of and to stick very tightly to the schedule to monitor blood sugar throughout the day. Muscle aches and weaknesses. Sometimes patients who might be reporting muscle aches and weaknesses, that can be, again, very non-specific. It can just be a routine musculoskeletal issue, but it can also be related to certain medications or changes in metabolism that are important to be aware of. And then mood changes. Mood changes is one to pay extremely close attention to, because mood changes are often one that might be the first sign. Again, non-specific. The mood change could just be something that's going on that day for that patient, but it can also be a sign of something to come. So one of the major takeaways that we want to have from this discussion is that the caregiver, if nothing else, needs to be a detective in the daily life of those who they're providing care for, in order to make sure that we're monitoring for these changes, and when we detect something, that we engage with the healthcare system and the community supports that we have in the best interest of the patient. So how do we do some of this monitoring? So regular health monitoring, hopefully the patients are connected to a healthcare team that are managing the patient's care, engaging regularly in the physical exams and the different types of evaluations as determined by the healthcare team, and staying kind of very vigilant in that to make sure that we're staying ahead of any potential conditions that can develop later in life. And that can be daily blood pressure checks, it might be ACU checks for diabetes, it could be any number of things, but making sure that we have that routine and that we're sticking with it. Good communication with healthcare providers. The good news is that's getting better and better as a system as time goes on. Things like patient portals and electronic medical records now are giving new and innovative ways for patients to communicate with their providers, even outside and in between appointments. So you can never over communicate. And so that's always tip number 1, 2, and 3 that I would give to a caregiver is have all the different ways that you can access your healthcare team, have it readily available, and have it easily accessible. So that way, if it's a patient portal message to your provider or a phone call to their office or whatever mechanism that is, that you maintain that communication. Of course, wellness factors into this, so lifestyle modifications, lifestyle adjustments. The longer that we live, it becomes more and more important that we prioritize our own health and wellness, emotional, mental, physical, and spiritual health and wellness. So good health, diet, and exercise is always something we want to prioritize. That's sometimes more challenging, depending on certain scenarios and your access and that sort of thing, but good diet and exercise, but even more than that, maintaining good emotional health. So making sure you take advantage of respite care opportunities, making sure that you leverage any family and psychosocial support that you have in order to preserve your own emotional support as a caregiver, which in turn promotes the emotional wellness of the patient themselves. Spiritual health, if you're a spiritual person, that's a great kind of opportunity to strengthen your overall psychosocial and emotional health as well. So prioritizing that wellness is something that really is critical for both yourself as the caregiver and the patient. And as Bill said, and I want to echo, that's not by prioritizing your own wellness in those scenarios, that's not being selfish, that's not, if anything, that's a direct investment in your own ability to provide the care to the patient in need. So that's something that we definitely want to encourage. And of course, we've talked a little bit about medications and the importance of being vigilant and working with your healthcare team to make sure that we're staying on that schedule. So, and we want this to be a two-way conversation, so feel free to, if you have questions, if you have thoughts, if you have comments, feel free to raise your hand and we'll have that discussion. But really, I just want to give some tips, some tips and tricks in order to kind of hopefully help folks who might be providing care and acting as caregivers themselves. And grossly how we're going to organize that is in terms of recognizing when help might be needed. So recognizing signs that we might need additional support and that sort of thing, both in yourself as the caregiver and the patient. And then once you recognize those signs, what do we do with that? What do we do in those scenarios where additional care or resources might be needed? And then finally, how to prioritize your own wellness throughout this whole process. So recognizing the need for additional help, signs that extra help might be needed. So the caregiver is typically the one that spends the most time with the patient. So you really know the patient. It's often a loved one and whatnot. And the caregiver or caregiver team is typically the most astute to any changes that are occurring due to chronic illness or due to medical intervention or that sort of thing. So monitoring changes in health status. Sometimes that can be subtle, and as we talked about before, it can be often non-specific, but it's usually a better decision to, if there is a change in pattern, if as an example, if the patient sleeps 5.5 hours every night, and then all of a sudden one night sleeps 8 hours or sleeps 2 hours or 3 hours, that's a change, and those changes might not be emblematic of anything specific, but they often could be. So monitoring changes in the health status, the daily routine, etc., is something that's a good, sensitive, and early sign that extra help may be needed. So if the patient also starts to develop increased needs, so if weakness develops and all of a sudden there's a little bit more support needed to support the activities of daily living, that's often a sign that we might need some additional help. Often with certain chronic illnesses, there can be mood and behavioral symptoms, and sometimes a change in a mood pattern or a pattern of behavior can be emblematic of changes in the patient's health. For example, if a patient is non-communicative for whatever reason, be it an Alzheimer's disease or any other condition that might be affecting their ability to communicate, it's often emotional or behavioral distress that's the first sign of an oncoming illness. So one of the most common things that we will test for in a senior behavioral health center, for example, if a person is non-communicative and all of a sudden they become more kind of upset or angry in their interactions with staff, we'll look for things like urinary tract infections. We'll do vital sign checks and tests of cardiovascular functioning and whatnot, because although the patient might lack the ability to communicate, with words verbally, they're communicating in their mood, behaviors, and actions that there might be something that needs further evaluation and treatment. So also something that we would call countertransference in the mental health field, but looking at our own stress levels in relationship to the patient. So if you're acting as a caregiver, that is a dynamic and multifaceted relationship that takes a lot in order to provide that care, and stress can go with that. As we are monitoring the patient, we also have to monitor ourselves to make sure that say, oh gosh, it seems like I'm getting a little bit more frustrated today than is typical. What might be going on there? And doing that sense of introspection and reflection, because that might be in response to a signal that we haven't yet detected. That might be us saying, well gosh, maybe it's because my wife or my spouse or whoever I'm providing care for hasn't been sleeping as well lately. Now that I think about that is a sign. Maybe I do need to schedule an appointment with my physician in order to evaluate those issues. So just some signs that extra help may be needed. And with extra help, needs for additional care. So, what do we do when we identify that extra help may be needed? First and foremost, always consulting with the healthcare team. The treatment team is always a good first stop. Also exploring things like home health services. There's an industry of home health services that we could always use more. The good news is that there's growth in the home health industry nationally, but we still definitely need more access to home health services. But exploring what home health services might be available to you is a great resource. Things like respite care. Respite care is important because those supports to give you, even if it's just a few hours a day or a few hours in the week, to give you as a caregiver that opportunity to recover and to preserve your own emotional, mental, physical, spiritual strength is something that, again, is an investment in yourself and in turn an investment in the care that you can provide to the patient. And then community resources. So even non-medical, supports like community groups, support groups, etc., can be wonderful when that additional care is needed in the course of being a caregiver. And then balancing caregiving with external support. So the first point I think is important there, setting realistic expectations. So we always want the best for the people that we're providing care. But we also have to understand that there are going to be good days and bad days, that there are going to be times where patients aren't as responsive to treatment as we would hope for, and to set realistic expectations for what we can do as a caregiver, and then finding resources outside of what we can do as individuals to try and help provide for whatever we're not able to as individuals. So making sure we have realistic expectations there. We want to maintain involvement, of course, so that kind of organizing and staying involved with the healthcare team and external supports. That, as we talked about, that informed caregiving is what's going to lead to better health outcomes, both for the patient and better care outcomes for the caregiver. So, and as we talked about communication, you really cannot over-communicate, and I highly recommend having all the different mechanisms of communication with your healthcare team, with your support teams, with your peers, with family, all located in one space. So that way, you're not going through the journey with the feeling of being alone, because often that can be the feeling that folks have, and that we don't want that, because that can have a negative impact on the mental health and well-being of the caregiver. So. Critical information when you visit the doctor. So more often than not, when you see one of these signs that extra help might be needed, or these signs that additional help might be required, the first step is to go to your healthcare team. So what are some tips for how to have that done in the best way possible? Well, medical history is the first, second, and third thing that we want to have a good grasp of. The caregiver spends the most time with the patient. The caregiver knows what's been going on with the patient, usually in greater detail than just about anybody else. So being able to give that detailed medical history is really that's the necessary detective work that the healthcare team is going to need in order to make the best decisions for the patient in their care. So that's chronic conditions, that's things that from the distant past, but it's also their current presentation as well. So being able to tell that story with as much detail as possible about the patient's medical history is incredibly useful. Current medication list. Remember, polypharmacy is something that is unfortunately common, and that's when you're on multiple medications for multiple illnesses. and it needs to be understood by the healthcare team exactly what each medication is, the dosages and what they're for, and whether or not the patient has been able to keep up with those medications, or if maybe they haven't been able to for whatever reason. All that's important because a non-specific side effect can be, that's helpful on the path towards kind of figuring out what's going on when those non-specific health signs and symptoms can develop as to whether or not they might be a medication side effect. So definitely something that's important. And then previous reactions to medication. So often, sometimes when we're doing a medication reconciliation, we'll have access to the medications that a patient is on today. Hopefully we'll have access to patients' medication lists from the recent past as well, but it's often the family or a caregiver that would know if a patient's been prescribed Zoloft instead of Prozac 20 years ago and had a particular reaction, and maybe that's not the best medication for this patient. So critical information to kind of have ready, and it can be difficult to get all this information together. So the best advice is once you do have it all together, keep it together and have that quick read kind of cheat sheet on the health history of the person that we're taking care of. And then preparing questions in advance. So this is important. This is a useful tip for when you're engaging with your healthcare team, because often especially if it's an urgent or emergent issue, there's a lot of stress and emotion that's going on during that time, both for the patient and for the caregiver. So it can be difficult to articulate clearly in those encounters with the healthcare team exactly what's going on. It can also be difficult to kind of codify all these signs and symptoms and different things into the picture that you want to paint with the healthcare provider in order to make sure they're truly grasping the entirety of your concerns with regard to the patient that you're caring for as a caregiver. So there's different ways to do this, but you can prep a list of questions in advance, even standard questions, to have with you, so that way you're reminding yourself when you go into the doctor's appointment with the patient. I have these 6 questions that I've collected over the past few weeks as I've observed my family member, and I want to go through these with you systematically. Always very helpful for the physician as well. Sometimes daily logs, kind of journaling some of the observations that you're making about a patient can be very helpful. So it's, sometimes it's difficult to remember clearly if we went from 6 hours of sleep on Monday to 7 hours of sleep on Tuesday to back to 6 hours of sleep on Wednesday. So logs and journals along those lines can be very helpful as well. If you start to get the feeling that there may be something going on, just keeping track of as many observations as you can make and then sharing those observations with the healthcare team can be very helpful in doing that detective work of what may be a potential health issue that can be addressed. And so asking clarifying questions, making sure that as an informed caregiver, you're aware of the treatment plan, and if there's questions about the treatment plan, definitely feel empowered. I'll write the prescription for you. Definitely feel empowered to ask as many questions as you need to with your healthcare team to make sure that you truly understand the treatment plan. If coming out of a doctor's appointment, the patient has been prescribed 3 new medications, and you're not sure, you might have heard one before, stop the team there and make sure you're asking the questions. Okay, let me make sure I really know. So you said this was morning and night. You said this was this medication, etc. Having that really clear. So you want to feel and you want to know that you have as strong a grasp of that treatment plan as possible in order to make sure that you can provide the best care possible. So definitely feel empowered as a caregiver to ask as many of those questions as possible, and then to take that forward in your relationship with the patients that you're providing care for. All right, and then we can't talk about being a caregiver without talking about self-care. So self-care and wellness is something that is critically important to making the investments in yourself as a caregiver that will in turn ensure and maximize the health and wellness of the patient that you're taking care of. So it's very important that you look for signs of stress in yourself. How are you sleeping? Has your diet changed? Has your mood changed? Do you feel like you might be struggling with signs of chronic stress and depression? Are you experiencing burnout? Burnout as a phenomenon really is along the lines of things like adjustment disorder and whatnot, the signs and symptoms of depression in reaction to acute and chronic stressors. So, we experience burnout in high stress situations when we don't have the appropriate outlets and relief and respite necessary to recover emotionally. So if we're seeing those signs in ourselves, it's important that we reach out to some of those community resources we talked about earlier in order to try and get that relief, so that way we can continue on providing the care that's necessary for as long as it is necessary. So self-care, wellness, mindfulness, meditation. For if you're tech savvy now, there's actually applications that you can put on your phone that help you do mindfulness exercises, scheduling that can help you prioritize walks and self-care, kind of self-care walks where you go out and do your favorite activities to just kind of give you that moment of reprieve. Some apps even do things like aspects of cognitive behavioral therapy and guided exercises there that can help you manage your own stress levels and levels of distress when you're providing care for the patient. So lots of tools out there that can be utilized. There we go. All right. So, and then once you know what works for you, if that's meditation, if that's wellness, if that's mindfulness, if it's just the walk in the park, you want to strategize. You want to have a very well codified strategy for that self-care. So, prioritizing your physical health, your emotional health, scheduling those breaks and the respite that's necessary in order for you to have that resiliency as a caregiver is absolutely important. And if you don't know how to do that, or if there's a gap in the access to the resources that you have, that's where the social and community supports can come in to provide that help as well. So, anything from local care management support to care supports that can be provided through your insurance coverage, through community groups, etc. Lots of opportunities. That's really one of the wonderful outcomes of events like this, is making sure folks know what is available in the community. And then seeking support. So just some examples there: professional assistance, home health, caregiver support, respite care, educational resources. Sometimes just understanding better the disease process and condition that might be going on for a patient that requires care can help the caregiver manage their own response to some of those stressors. Understanding the to the extent possible, the mechanisms of a patient's chronic illness can help you manage your anxiety with regards to managing that illness, in other words. So again, it's that informed caregiver relationship that can be very helpful. All right, so those are the slides. Just to kind of recap, as a caregiver, you're often, to a great extent, actively engaged in the treatment plan. You're a critical part of the healthcare team, so it's important that you understand some degree of what's going on as much as possible with the care that's being provided in the treatment plan. So medications, what common medications are there? We talked about a few today, and what can be some side effects to those medications are important things to know. Recognizing when extra help is needed, what signs and symptoms in yourself and in the patient should be early detection that we might need to engage with extra resources to provide some of that care. When we need to go talk to the doctor and engage with the healthcare team, what critical information does the doctor need to know, or the healthcare team for that matter, and how can we efficiently and effectively communicate that information? We talked about some strategies there. And then finally, self-care and personal wellness is really the recipe for success, because chronic long-term illnesses are by definition chronic and long-term. and it's definitely a marathon and not a sprint. So by investing in yourself, you're actually making that direct investment in your ability to be the best caregiver possible, and that's something that is should be a priority. So I'll write the prescription for it if you need. That's my last slide, I'm pretty sure. But I'd like to open for discussion. If there's any questions, if anybody wants to share anything, or if we can be helpful in any way. Yes?
The last part you mentioned about investing in yourself to be able to take care of your loved one, I imagine that probably may come with some sense of guilt, maybe, and being able to step back and say, you know what, I need to go have a massage for the afternoon, and maybe solicit the input of siblings or other family members or even outside resources to help take care of that loved one. What are your suggestions about, you know, being not feeling guilty, just being able to step back and say, I need a break from mom for a little bit?
It's a great question. So to be an active caregiver and an informed caregiver often kind of follows a similar kind of set of emotions as what we have classically called the response to grief. You know, so if you're providing care, if a loved one gets a diagnosis that you know they're going to need care over the long term, you know, you're going to have your own internal process with that, fear, anger, etc. And more often than not, folks want to be the absolute best caregiver that they can, and so they jump in, at least initially, with, you know, wanting to be as engaged as possible. Sometimes with unrealistic expectations, you know, and that's, you know, it's that marathon, not a sprint mentality. But that can be a difficult thing to accept. I strongly advocate for things like therapy for caregivers, for example, just to, even if you don't feel like you're struggling with, if you know, therapy can be preventative, you know, to give you those tools that are necessary in order to kind of prevent you from feeling that sense of guilt or that sort of thing. And often talking to others, so peer support, community support groups, etc. So folks who have been providing care for a loved one for a number of years have lots of insight into the emotional experience that they went on in order to get to the point where they could go get the massage that afternoon, because they know that by doing that, they're actually providing care. You know, they're providing the self-care that turns into care for the patient at that time. So, you know, it's making an investment. It really is. Any other discussion?
I have a question.
Yes.
How do you manage when the person you're taking care of has several doctors? You have a neurologist, you have a psychiatrist, and you have a primary care physician, and then you talk about, okay, I see something different. Well, who do I call first?
So that is a great question.
Which doctor do I call?
That is a great question, and that's so. You know, I'll give my kind of couple of minute kind of speech on you know, how sometimes the medical system can be a bit, if not quite, disjointed in that way, just because of how it's structured. The answer is really the patient, the caregiver has to really be the strongest patient advocate for that patient, and really has to be as much of a detective as possible in that scenario. And I encourage the caregiver to, if they're confused about what, gosh, Dr. A says to be saying something and Dr. B says to be something different, don't let either Dr. A or Dr. B off the hook. You know, we until the caregiver feels like they have a plan that makes sense when they're advocating for a patient who, by nature of their chronic illness, may not be able to advocate for themselves, is absolutely critical. When the system works best, you have a primary care physician that's the primary quarterback of the care plan, and they're making referrals to specialty care providers in a coordinated fashion, and communication is flowing freely, and they have treatment team discussions, and the outcome is well communicated to the patient and the treatment team in a way that makes sense, etc. That's when the system works perfectly. I think everybody in this room knows that the system doesn't always work perfectly, and sometimes if your cardiologist is part of a system over here, and your primary care physician is part of a system over here, and your psychiatrist is a private practice person over here, it's not necessarily, that clear coordinated picture. That's why I really advocate for simple logs, simple kind of care logs, and you can call it, it's basically a diary of the care experience. So that way, when you're going to all the different providers, you have the date of what's going on, you have your understanding of the synopsis of what the provider has told you, and all this, and you take that to each and every appointment. So that way, when you go to the neurologist, you don't have to think about what the psychiatrist said. You've got that right there and kind of ready to go, with your understanding of the care plan, because your understanding is ultimately the most important piece, right? Because as the caregiver, you're probably the one that's implementing the care plan. So it's not a perfect system. I will say that innovations in electronic medical records and different things are promoting things like health information exchanges and whatnot. So where different healthcare systems are actually better able to communicate with each other electronically. You can actually see I can see what Dr. X is prescribing to the patient, and I can see that the meds were filled or were not filled at pharmacy-wide. That technology is now much more common and much more routine in medical care than it was 5, 10, 15 years ago. So those are good, but I think the patient advocacy of being that advocate for the person you're providing care for is kind of the best technique. It can sometimes feel unfair because you might feel like you're struggling against a system, but that's why it's important to have that self-care as a caregiver as well. But great question, and I think something that probably a lot of caregivers struggle with would be my guess. Yes.
Just to make a comment, I know a lot of people feel that self-imposed guilt. I have the opposite, and I am seeing a therapist who's in the room who I see more often, because my family, probably culturally, I have both parents living with me, and they don't have Alzheimer's or dementia. But culturally, they tell me all the time that I'm supposed to be taking care of them, and they make me feel guilty if I'm not home at a certain time, and I shouldn't ever leave the house.
Yeah, so, we are all, so there's well, I like to joke with some of my colleagues at times. I'll say to my cardiologist friends, I say, you really got it easy. The heart's just a pump. How hard is it just to keep a pump going, right? And I'll joke with the orthopedics folks. I'll say, levers and pulleys, that's all it is, right? And it's the mind and our mental wellness is really the most complicated. I'm a psychiatrist, so I'm biased in that. But our mental health really is affected by a combination of so many factors, psychosocial factors, so our own stressors in our life, our own interactions with others, the supports that we have from others, our frame of reference, right? So that be that a cultural frame of reference, be that a socioeconomic status, our background, all those things impact our frame of reference with how we approach mental health. Biological factors, right? Some of us are more predisposed to things like depression or anxiety or others. So all of those things come together, and when life throws something at us, that can impact our ability. That all that comes together to culminate in our ability to respond in those situations. So we all want to respond in the best way that we can, 100% of the time. But we are all people that have our own strengths, weaknesses, fallibilities, etc. And so that's why it's important to make this a team sport, I would say. Not try and take this on individually, but look at those community resources, look at those behavioral health resources, look at everything that's out there, and really approach being a caregiver as a team sport. I think that's the best recipe for success. Yes?
I was wondering if you might have any specific recommendations or comments about folks who are kind of in that post-caregiving phase. As Mr. Hunsberger had said, at some point you have to recognize that the home environment is unsafe, or that they're no longer able to function in that environment, and the caregiver has to let them go to a secure facility or a healthcare facility. A personal anecdote, if that's okay, I have an aunt who's only 51 years old, who's in late stage Alzheimer's, and she had to unfortunately stop living at her home and go to a facility out of state. And my aunt wants to see her all of the time, as much as she can, before the disease progresses, whereas my mother, it's soul crushing for her to have any interaction with the aunt, but obviously she wants to be around her and wrestles with guilt about not wanting to be around her and things. So I was just wondering, for those who have had to let go and wrestle with those kinds of thoughts and feelings, anything that you might recommend? I know the self-care obviously and things are important, but just in that particular part.
Yeah, so that could be a difficult transition point, and the easier said than done, factor is to kind of try look and remind that at those transition points that you want to act in the best interest of the patient, of course, but that's the easier said than done part, right? And whenever those transitions happen, I think that's important to have that internal sense of self-reflection, to look inward and say, okay, how am I responding to this? Am I experiencing burnout? Am I experiencing signs of depression or anxiety? Much more common than a lot of people recognize. And then how am I going to manage that? And kind of having a care plan in advance. If we have a chronic condition where there's a high percentage of likelihood that transition may be coming, either with a therapist or with a peer support or with just good friends and family, starting to think through that plan and starting to process that internally in advance can help that transition point a little bit. The last thing I'll say to that too is probably, I think, an example of this event is that altruism is a great help in the kind of that post phase. When you're dealing with the process of somebody becoming progressively ill or more ill, it's important that you tackle that acutely first within yourself and with the patient. In that post phase, if the patient passes or that sort of thing, altruism is a great, once you're at the point where you're emotionally ready for that, being able to share your experience with others in forums like this, and to give outreach and support to others can be a wonderful source of emotional wellness.
Thanks.
Bill?
I just want to respond a little bit. In my trip with Sylvia, it got down to a point that safety was a problem, and she was starting to fall. And so trying to make a decision that, she couldn't stay at home was hard to get to. But I got to it before at least one of my sons, and he didn't think that, he thought that she should stay, and that's where she could probably die, right? And so I had that little bit of struggle, but I just said, you know what? I'm the guy here, I'm on the front lines, and you're not. And so we did do it. I mean, it's very, very hard to do, but you're not always going to have everybody with you, is what I'm trying to say. And they all look at it from a different point of view, and as the caregiver, you have to be the leader and make things happen. As hard as it is, but I see you struggle with it. Yeah, for sure. Yeah.
Absolutely. I think that also brings to mind, as we think about, again, we started the talk with talking about kind of societal and epidemiologic changes that are going on in the world, where because luckily medical science has advanced to the point it is, we're all living longer, which is good. The average lifespan, at least in developed countries, is increasing, but with that comes more morbidity related to chronic illness and that kind of thing. So it's more likely now than 100 years ago that a higher percentage of us will have a chronic illness of some form or another. So I always do advocate for thinking before anything like, so in your early in your life and then throughout at different phases of your life, what would be some of your care plans and care wishes and that sort of thing if you were to develop a chronic illness of some type, prioritizing home health care, this, that, or the other. All those things can be helpful. So that way the caregiver and the family members have a sense of your wishes throughout time, because that can be very important. Yes?
What do you do when you're a caregiver and, I'm a caregiver for my mom, and she doesn't want anybody else to come in and help. She doesn't want family to come in, she doesn't want friends, she doesn't want her church members, she doesn't want anybody. She just wants me, and every now and then, people will say, well, you need to get out and have fun, and I do, every now and then I go out to little functions or something. But what people don't realize, when you come back, you still have all that stuff to do while you were out that you didn't do, or you have to do it before you leave, so you're exhausted, when you get home, and then your mindset changed after you get home, like, I had fun, but why did I go,
Yeah.
But now I have all this to face when I get back,
Yeah, it could be very challenging, and remembering that folks who are struggling with a chronic illness are often at a very vulnerable place in their lives right now. So when we're in those vulnerable places, sometimes that will trigger things like emotional stress responses and whatnot, and that can lead to things like, well, gosh, I don't want anybody else. It can only be you. And we know that that's not a realistic request, and that sort of thing. But it's it's a challenging situation because it's almost where you have to kind of, I'm thinking of a parent-child dynamic where it's you have to kind of make sometimes the tougher decision in order to prioritize both your health and wellness and your loved ones, and sometimes have the emotional tools and the resilience there because of all the investment in yourself that you've done, in order to understand that they might not always appreciate that, but it's a tough situation.
I think you might want to remind your mother that if she really wants you to be there to help her, that you can't do it 24 hours every day. You know what I mean? That you need support, and if you don't get the support, you're right. I'm sure you've said it,
Yeah.
but you have to say it again and again, and then do it. Then you have to do it. That's what you'll get the message when you start having somebody else come in for, say, 4 hours. Then she'll understand what you're talking about. She'll be upset with you, but she'll get used to it.
All right, if there's nothing else, I really appreciate the opportunity to have, gotten a chance to meet you all today and speak. If there's anything that Brook Lane can do to provide support or anything, we're always happy to. I think this is a wonderful forum. I appreciate everybody's time, and I hope you enjoy the rest of your day.